So, systematic reviews of prevalence data are not new. However, conducting a systematic review of reviews of prevalence data to inform the outcome focus of an effectiveness review was very new to us at the Epicenter. We have been tasked with conducting an effectiveness review on population mental health interventions as part of a wider ESRC-funded evidence synthesis project to inform policy and practice decision-making in a post-pandemic context. Since the start of the pandemic, there has been concerns about how best to tackle the growing burden of mental health issues arising during COVID-19. However, this was accompanied by a lack of clarity regarding which mental health symptoms were more elevated in the general public. To support us in deciding which outcomes to focus on in our review, we decided to consider the growing evidence base of prevalence data identified when producing the COVID-19 living map of systematic reviews. From the 98 systematic reviews we identified, 19 were able to provide pooled estimates on the prevalence of mental health issues in the general public, or subgroup analysis that had been disaggregated data from at-risk groups such as frontline workers. Overall, anxiety, depression, and PTSD were the most commonly reported outcomes, along with sleep difficulties and overall emotional and psychological well-being. However, when investigating the evidence base further, we found a number of methodological limitations and challenges. Firstly, as the majority of reviews note, there was an ongoing reliance of cross-sectional primary studies, many of which, by the author's own admissions, were done at speed to meet local needs for current data rather than speak to generalizability of mental health issues at population level. Only 2 reviews synthesized evidence from studies with pre-pandemic measures to enable comparison between pre-COVID and post-COVID rates of anxiety, depression, and post-traumatic stress disorder. Although both reviews reported an increase in those symptoms, the lack of ongoing data collection make it difficult to establish if presentations are situational, temporal, or a sustained problem. Secondly, the size of the evidence base was difficult to ascertain at the outcome level, with most reviews reporting the number of studies rather than the total number of participants, raising further questions about the magnitude of the problem. Thirdly, only 1 review conducted a meta-analysis on the impact of COVID-19 on children and young people, highlighting an ongoing issue with producing prevalence data on mental health problems for younger cohorts. However, despite these issues, investigating systematic reviews to inform the scope of an effectiveness review supported us to have more meaningful and empirically grounded dialogues with stakeholders. The primary outcomes identified were corroborated with their clinical experience during COVID-19, including the lack of synthesized evidence on children and young people that they could usefully rely on. Further exploration of the value of drawing on review-level evidence of prevalence data to inform systematic reviews of interventions is warranted to consider how it can increase the production of policy and practice relevant reviews.